Good morning and thanks for waking up with us today. I am joined by Dr. Casey Harbine for another edition of Morning Rounds. Thanks for joining us this morning.
Yeah, you bet.
Today we're talking about when to take and when not to take daily aspirin. So the first question is, many people take daily aspirin. Some recent conflicting reports though about whether it may be good.
Right. So the main recommendation behind taking a daily aspirin is for prevention of heart attack and stroke. What we know is that people who have heart disease and vascular disease, aspirin has huge benefits for what we call secondary prevention. So what secondary prevention means, you've had one event, now you're trying to prevent the second event. Primary prevention, which is when you're trying to prevent your first ever event, is a little less well understood and probably depends a bit on your risk factors. So diabetes, that's an automatic qualifier. What diabetes does to your blood vessels is it breaks them down and causes vascular disease, and people probably have it for many years before they're symptomatic. And so that's a general recommendation, almost equivalent with having had an event. And then people with 3 or 4 risk factors, so high cholesterol, family history, smoking, hypertension, they probably also receive a benefit from primary prevention, preventing that first attack by taking an aspirin. But people at low risk with minimal risk factors, probably the risks of taking aspirin probably outweigh the benefit.
And then off that topic, what are the risks of taking a daily aspirin?
Right, so the way aspirin works, and the reason we use it, is it prevents platelets from clumping. Well, platelets clump for a very good reason, to stop us from bleeding. So the obvious risk is it can cause bleeding complications in places where we don't want them, particularly in your head or in your GI tract. So the other way that aspirin can cause things like ulcers that we hear about is it actually prevents the cells of the stomach lining, which constantly have to grow to protect breakdown, from growing and doing that. And so ulcers form. So you have the combination of bleeding and ulcer formation. There's probably increased risk in people with kidney disease as well. Those risks are much higher with a full dose aspirin compared to a baby dose aspirin, 325 versus 81 milligrams, and also much higher in those over 70 years old.
Are there any other reasons to take daily aspirin?
So, other reasons might be, there's some studies that have been coming out that we've talked about before, maybe those at really high risk for colon cancer with a family history or other genetic predispositions. They've shown some benefit maybe to daily aspirin, but those studies are pretty young and new at this point. And so really it's primarily for heart and vascular disease.
So what would your general recommendation be?
So don't just start taking aspirin because you think it's going to be good for you if you don't have a lot of risk factors, if it wasn't recommended by your doctor, or if you're over 70 years old. But if you have had an event and your doctor, especially your cardiology doctor, someone who's managing your heart and vascular disease, has recommended it, then really the benefits probably in that situation outweigh the risks, but in knowing the risks are very important.
All right, well, thank you for answering some of those questions for us here on Morning Rounds. If you have any health-related questions you'd like us to answer, you can email them right to us, morningrounds@kpax.com.